We welcome Dr. Russell Samson from Sarasota Vascular Specialists into the studio today to discuss varicose veins. Thank you so much for joining us today.
My pleasure, thank you.
There's a lot of misconceptions I know about this particular subject, so we'll get to those. But can you start with what is the difference between varicose and spider veins?
So varicose veins are the bulging blue veins that you see running down a person's leg. And they're big and they're obvious, they look like ropes. Spider veins are little tiny little pink, usually sometimes blue markings or blemishes on the skin. They don't really raise up.
Okay, can those come at any place on the body, or do they specifically?
They can occur anywhere, but strangely enough they occur predominantly on the legs.
Okay. And what happens if varicose veins aren't treated in a timely manner?
Well, one of the reasons that I'm here today is to put to rest some of the things that you may see in advertisements, in magazines, TV and newspapers about the dangers of varicose veins. I think people have to realize that the majority of times varicose veins are just a cosmetic problem. They very, very rarely lead to trouble. So when you see an ad on TV saying beware of your varicose veins, you could lose your leg or lose your life or get into lots of problems, you have to be very suspect about that advertisement.
Okay.
Because most times it's a very simple condition that we take care of for cosmetic purposes.
Okay, so that's basically what it is. So that's, I know, because for so many years I've heard that you know, these are very dangerous, detrimental to your health. So that is not necessarily true.
Very rarely. So varicose veins can cause pain sometimes. They can sometimes get a blood clot, but a blood clot in a varicose vein is not a dangerous blood clot like a blood clot in a deep vein in your body. And sometimes if you have veins for a very, very long time, you can get discoloration of the ankle and even an ulceration of the skin. But that's very, very uncommon.
All right. So in that case, then what would you do for a treatment for varicose veins?
Well, the treatments are the same whether it's for cosmetic purposes or for a real medical indication. First of all, you have to eradicate the varicose vein. So we have a very simple procedure under local anesthetic in the office. We make a tiny incision under local. We have a specially designed hook that grabs the vein, and interestingly, the vein's got no pain fibers. So when you pull it, the patient feels virtually nothing. Can I have your hand for a minute? So this is all that the patient will feel, a pulling sensation.
Oh my goodness.
They feel the skin moving. They don't feel any pain from the vein. We put a little steri strip on the incision, put the patient in a stocking, they go back to normal activity without even taking a Tylenol.
Okay, now, so how much of a vein are we talking about you taking out with this little procedure?
It's amazing. Through a tiny incision like this, we can sometimes take out as much vein as that. Now, some people will also have a vein that runs up the inside of the leg called the saphenous vein. It has valves in it that may not be working. And if that vein is very distended, very enlarged, and certainly not working properly, we get rid of it with what we call an ablation. And that's done under local anesthetic. Again, in the office, we use a device that burns the inside of the vein and destroys it. Not everybody needs that, and one of the reasons, again, why I'm here, a lot of people are having that procedure unnecessarily. So it's not only that you get an unnecessary procedure, but that's the vein that we use for, if we ever need to do a heart operation and we need an artificial artery, we use that vein instead of an artery. So if you've had that vein taken away by mistake or unnecessarily, and you ever need a heart operation in the future, you're out of luck.
Oh my goodness. That is something that, again, I've never heard before, so I'm getting quite a bit of medical knowledge that I appreciate, because you never know. I mean, this is the whole point about people when they're getting older. I think they need to have more than one opinion from someone. And I think
so when I was in New York, there was a clothing company called Samson, and they always said their best customer was an educated customer. And it's the same thing here. If you're going to be having something done to your body, you should really know what's going on with that condition.
Okay, now we want to get into laser treatments because we hear so much about that now. What kind of laser treatments?
So again, everybody thinks a laser is something that's very gentle. In fact, laser works by heat. So the laser that we use is 1,000 degrees centigrade. So if we put that on inside your body and we didn't numb you up, you would go straight through the ceiling.
I guess.
So
oh my gosh.
the laser that we use is not some gentle magic wand. It's a specific device.
Okay.
Now we do use it and it is important, but it's not for the surface varicose veins. It's for that deep vein that I was telling you about, the saphenous vein. That's how we destroy it with the laser.
Okay, that's the ablation that you were talking
And that
about.
has replaced what we used to call a stripping operation. That procedure is virtually gone now.
Okay. Well, of course, you've made so many strides in medical
Technology.
Technology, thank you.
Definitely.
So all vein doctors are not created equal, and again, how do we know how they've been trained?
Well, the only specialty that's really been trained and certified by the American Board of Medical Specialties are vascular surgeons, so people that not only take care of veins but also arteries. There are other doctors that have been to courses that may have learned how to do these type of procedures, but they're not really specialists in the area. So if someone is looking to go to someone who's really knows about veins, ideally it should be a vascular surgeon.
Okay, so that's the first thing that they should look for. Any other questions that come to mind that they should ask?
Well, I think they should know how many procedures the person's done, and if they aren't a vascular surgeon, where were they trained? Where did they learn the procedure? And what is their idea about treatment? Do they treat everybody whether they need it or not? Or what type of testing do they do? Do they have a certified lab to do the testing? These are the things I think a patient should ask.
Okay, great. Well, thank you so much. I've learned a lot, and I'm sure our viewers have as well.
Hope so.
And we look forward to having you back very soon.
Good, thank you.
Thank you, Doctor.
Thank you.
Thank you for joining us this week. All our episodes are available online at www.snntv.com under Programming. Tune in next week to Aging Gracefully on Suncoast FYI.